Nearly 18 million people are expected to lose Medicaid this year. So let's talk about who's going to be affected, how experts estimate that millions of eligible people are still going to lose their benefits anyway, and what you can do to get free or low-cost healthcare if you lose those benefits. There are actually a lot of options out there, so please don't lose hope. As you probably know, Medicaid is a government-funded health insurance program that provides free healthcare to low-income individuals and families. This has been a literal lifesaver during the pandemic. In March 2020, the government created something called the Continuous Enrollment Provision. This rule required states to maintain Medicaid coverage for most people throughout the entire COVID-19 emergency. That meant that if you were enrolled in Medicaid when the rule took effect on March 18, 2020, then you could not be removed from that program until the end of the public health emergency. If you became eligible for Medicaid after that date, your coverage was also protected. Basically, this rule meant that states didn't have to recertify anyone during this period. Well, that's over. The government decided last December that this provision would expire on March 31st, 2023. And now states have to begin reviewing that information for every person who is currently enrolled in Medicaid. Over the next 14 months, every single person who is receiving Medicaid will have to undergo a thorough review to make sure that they are still eligible for that coverage. That's 84 million recertifications that have to be processed, and that's an extraordinary workload for agencies that are already overworked and understaffed. The result is that 18 million people are expected to lose their healthcare coverage starting this month, so that's a lot. But there is good news. If you are still eligible for Medicaid, you should be able to keep that coverage. Now, if you are eligible for Medicaid, you should be able to keep that coverage, but you need to make sure that your information is up to date with the state office that administers that program. If you've moved, got a new job, switched phone numbers, anything like that since March of 2020, you need to make sure that they know so that they can get a hold of you. If they can't reach you, you could lose your benefits even if you are still eligible. The Center for Budget and Policy Priorities has stated that eligible individuals and families, particularly people of color and children, are at risk of losing coverage during the winding down process. Eligible enrollees could lose coverage if Medicaid agencies struggle to answer calls or field questions, or if they fall behind in processing paperwork in a timely manner. Nearly 7 million are projected to lose Medicaid coverage despite being eligible due to procedural reasons caused by administrative barriers, such as long wait times, multiple unnecessary requests for paperwork, and eligible people losing coverage at renewal and having to reapply, a process known as churn. But don't panic. There's still a lot of help out there, even if you don't qualify for Medicaid. I've been looking for low-cost healthcare options for a long time, and I found a lot of things that can help. So let's talk about your options. First, direct primary care is my favorite affordable healthcare solution. I recently became good friends with Dr. Jenna Silakoski, a DPC provider in Idaho. In Jenna's words, direct primary care is a nationwide movement to take medicine back. Physicians who practice like this take the middlemen out of the system and put the relationship back between the patient and the physician. It's a model that's similar to a gym. For a low monthly fee, all primary, urgent, and preventative care, usually 30 to 60-minute appointments, done in office is done at no additional expense. There are no copays, no deductibles, and no hidden fees. Medicine should be transparent and relationship-based. I love that. You pay one monthly fee to get all of your in-office medical care with no extra fees. It's beautiful, it's simple, and it helps providers like Dr. Jenna provide even better care to their patients. There are around 2,000 DPC providers around the U.S. right now. You can find them in 48 states and Washington, D.C. The DPC Frontier site has a great map of different DPC providers that are out there. Second, CareUltima is an affordable service that I use for my family, and it's honestly amazing. It's another low-cost subscription program, but instead of offering you in-office visits, CareUltima provides 24/7 access to online providers through Teladoc. This network is actually the very same one utilized by 40% of Fortune 500 companies who offer it to their employees. I tried it myself last week, and I was very impressed. So I have an autoimmune disorder, and I get all sorts of crazy infections and healthcare problems all the time. I hate wasting time at the local urgent care or trying to squeeze into my doctor's office at the last minute, because once I feel bad enough to need an appointment, I don't feel like traveling or waiting anywhere. So last week I had a really bad infection and I knew that I needed to get antibiotics. I've been through this before. So I used my CareUltima subscription. It took me less than 5 minutes to connect to an online provider. The appointment lasted around 3 minutes, and the provider sent my prescription to my local pharmacy right after the call. I had an antibiotic in my hand within the hour, and since I sent my husband to pick it up for me, I didn't even have to leave home. It was easily the best experience I have ever had in my life when it comes to doctor's appointments. Now, for one flat rate, CareUltima will offer this same coverage to every member of your household, you, your spouse, your dependents. And in addition to access to Teladoc, the subscription also includes prescription discounts, access to health advocates, and additional services. I've had the honor of working with this company as they designed a custom package exclusively for our low-income relief audience. They've set an affordable monthly rate and included some amazing options to make it even better. To get that special plan, you will need to sign up using the affiliate link below. Third, CHIP. The Children's Health Insurance Plan is similar to Medicaid, but slightly different. This program provides low-cost health insurance for children when their families earn too much to be eligible for Medicaid, but not enough to afford other healthcare solutions. If you are losing Medicaid as a household, but you have children in your care, look into CHIP. Fourth, look for your local community health center. These centers are nonprofits that offer free and low-cost services to low-income patients. Most of them offer sliding scale fees, which means that the amount you pay will depend on your income. And if your income is too low, you often don't have to pay at all. You can find your local community health center by calling your local health department or by visiting the search tools on the Health Resources and Services Administration website, which I will link to. Fifth, look for free clinics. These volunteer-run clinics provide free and low-cost healthcare services to uninsured and low-income patients. Because the demand for these services are high and the clinics rely on providers volunteering their time, they are often very limited in what services they will provide. That being said, I recently reported on the Doctors Volunteer Clinic in St. George, Utah, in one of our recent live updates. This all-volunteer clinic is 100% funded by grants and private donations. They have over 35 doctors, and they provide dental, primary care, specialty care, and mental health services to eligible patients. So clearly, some volunteer-free clinics are actually very robust and comprehensive. You can see the list of all the free clinics I've found around the United States at lowincomerelief.com, and I will link to that as well. Sixth, you may be able to get help with your prescription costs from local churches and charities. There are many that provide assistance with medications. Some counties also have a general assistance fund or a welfare fund that can assist you with medications. You can usually call 211 to find those resources in your area. If you're in New York City, that'll be 311 instead. Seventh, if you absolutely have to, hospitals. This should be a resource of last resort because hospital bills can be insanely expensive even after you receive financial assistance. However, the Emergency Medical Treatment and Labor Act of 1986 requires hospitals to provide emergency care to anyone who comes into the emergency room, regardless of their ability to pay. Hospitals that are registered as nonprofits must also provide financial assistance to low-income patients, although there are no federal regulations about what the criteria must be or how much assistance must be offered, so that's not exactly reliable, but it should be an option for you. Now, if you're facing the loss of your Medicaid coverage and you're affected by a disability, you may want to consider applying for Social Security disability benefits so that you can also get Medicare coverage. I know that that process is daunting and it can be very overwhelming, but our friends at Atticus make it easier. They have a 2-minute quiz that can help you determine if you're eligible, and they can even help you fight for the benefits that you're entitled to. If you would like to get started, visit our affiliate link in the description below. Most disability benefit programs that I've found include some sort of healthcare component. This is also true for veterans. For example, veterans who have a service-connected disability can get free healthcare from the VA. I'm putting out another video about how that works on our Fast Facts by Low Income Relief channel, because I have a feeling that if I bore you with that here, our whole channel is going to suffer, because I know it's kind of dull. So if you want more information about how to get healthcare for veterans, please go check out that other video, which again, I will link in the description below. Also, veterans who are rated 100% by the VA who receive individual unemployability benefits or who participate in the Family Caregiver Program can also get CHAMP VA healthcare for their dependents. CHAMP VA is actually pretty darn good coverage. In my experience with the veterans in my life, the dependents typically get better care than the veterans themselves. It's an amazing program. Now, for more ways to get help, don't forget to check out our video on hardship grants. I'll see you there.